Good afternoon, and thanks for joining us virtually. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness for Knox County Health Department. Our moment of gratitude this afternoon is dedicated to Kroger Health and our county and city partners who came together to make Friday and Saturday's drive-through testing opportunity a reality. By increasing our opportunity for testing, we are able to get a better picture of the state of health in Knox County. We want to thank Kroger Health for working with us to organize this event, as well as the city of Knoxville for allowing us to use the zoo's parking lot for the testing location. We want to stress that individuals must meet CDC guidelines for testing and be approved by Kroger Health prior to testing dates. We have more information about registering the process, including Kroger Health's phone number, on our website and social media platforms. Moving into the local situation, we have 85 confirmed cases of COVID-19 in Knox County. 42 people have recovered. 13 have been hospitalized at some point in their illness. We have no additional deaths due to COVID-19 complications at this time. I want to take some time now to talk about hospital surge planning, since we've been getting a lot of questions on this topic. I've spent the majority of my career here working with our local hospitals and healthcare partners to support their planning and response efforts, and I think it would be good to offer some more information on this topic to help address some of the questions and concerns we are hearing. First, if you are interested in the details of what surge planning can encompass, the guidelines, the measures, the references, and the recommendations are widely available to the public from the same resources that the hospitals and healthcare communities use to form their plans. There are resources that include guidance and planning measures that should occur on websites like the Department of Health and Human Services Assistant Secretary for Preparedness and Response Hospital Preparedness Program, it's a long one, CDC's Public Health Emergency Preparedness Program, Centers for Medicaid and Medicare Services, or CMS, and accrediting bodies like the Joint Commission also provide guidance and measures to our hospital partners. There are also numerous scholarly articles in journals available that focus on this topic and make recommendations on how surge capacity can be increased. These are just some of the resources that the hospitals and other partners utilize for their planning efforts. We have frequently referenced some of these guidelines when we answer questions on this topic. Things like putting out guidance on who really needs to go to the hospitals in this situation and canceling elective surgeries are examples of surge strategies. To take a deeper dive, surge planning guidance generally relates to buckets that fall into what we call the 4 S's. The first 3 S's are staff, space, and stuff. And all of the ways that plans are implemented are based on the final S, which is the situation. Surge planning guidance recommends things like changing patient flow. That falls into the space bucket. Providing staffing in different ratios or capacities, that can fall into the staff bucket. Expanding beds into new areas of hospitals that aren't typically used for patient care. That's another one that can fall into the space bucket. Implementing PPE conservation guidelines established by the CDC so that their resources last longer. Those are things that fall into the stuff bucket. The situation dictates how these and many more strategies are implemented, which is why things like the number of beds available or needed is a complicated question to answer, because it all depends on so many other variables. It's not black and white. I know that there is a desire for more information, but we cannot stand here and describe each hospital's individual plans to you, because they are all slightly different given their individual circumstances. However, they all follow similar guidelines and principles. To provide a simple metaphor, it's like our emergency planning guidance we have been provided as individuals for a fire in our own home. The general guidelines are still widely available to us all. We can look them up from numerous resources. They recommend that you plan to do things like stay low to the ground to avoid smoke, exit your home, and have a common rally point identified for your family. but it would be impossible to explain the details of how these guidelines are implemented in individual households due to all of our differing circumstances, what our space looks like, what resources are available, who is in our household, and the situation itself, how bad the fire is, for example. The bottom line is that if we do our job as a community and continue to follow social distancing guidelines, if we stay away from each other and avoid getting sick ourselves, we do our part to flatten the curve, which helps the situation that our hospitals and healthcare partners are facing. This makes the challenges associated with addressing staff, stuff, and space more manageable in times like these. Regarding the release of specific numbers of beds and resources in the Tennessee Healthcare Resource Tracking System, or HERTS, this is a state system, so the state will have to answer questions about it. However, I can say this: our hospital partners participate in the system voluntarily. They have long been ensured that this data will only be used between the participating partners and public health to assist in resource allocation and movement during emergency events, as the data in the system is very much a snapshot that is dependent on so many other factors. I do want to clarify that data is now being collected in HERTS for masks for our hospitals. Including this resource is new to the system. Nevertheless, questions about HERTS should be directed to the Tennessee Department of Health. And now I'll open it up for questions.
All right, the first question comes from WBIR. They say nearly half of Knox County cases have recovered at this point. What do you think of that? Should we see it as encouraging?
I am very encouraged to hear that nearly half of our cases have recovered. I think that's a very good thing for us. The data supports, we've been talking about this for a long time, that 80% of individuals have mild to moderate infections. And I think we're seeing that here. And that's important that people remember that. All of these measures that we're doing are very important to continue, so those people that do get very sick and do need hospital beds have the resources they need when they need them.
The next question is from WUOT. They say there was a discrepancy yesterday in the number of negative tests reported by KCHD and the number of negative tests reported by TDH. 1,090 for KCHD and 673 for TDH. Is that the result of a data lag? What explains the different numbers?
There are a lot of different factors from when we pull our data versus when TDH, Tennessee Department of Tennessee Department of Health pulls their data. There can be a difference in lag time. There was also some duplicates in the system yesterday that they cleaned up. They let us know about those as well. So there are occasionally differences. We too try to validate our data and continue to do that every day.
From KNS, they've asked, coming back to our questions about ventilators in Knox County. Yesterday, Dr. Buchanan said the number was not a secret, but is held at the state level. Is there a legal issue preventing the county from releasing that information?
So we provided some clarification on that. This is a statewide system, as I said before, and they have the authority to release information out of that system if they want to. And we're not going to do that at this time.
From WBIR, do you expect a spike when drive-through testing starts like we saw in Blount County?
I think that as we increase testing in general throughout the community, we do expect to see more cases at this time. And I don't think that's going to be unexpected if we see that. Again, this is all things that take some time to unfold, and more people that are getting tested or able to get tested is a good thing for us, even if our numbers do go up. It gives us a better picture to help us frame our response better.
If you're on the call, can you please mute your mic? Thank you. All right, the next question is from WATE. Governor Lee predicted the peak of COVID-19 cases around April 19th through 20th. Are health department officials looking at the same peak here in Knox County?
I think there's a lot of modeling that's going on, and we are looking at all of the information that we can get. And we're also going to be looking and continue to look every day at our local data and our local picture to be able to inform our response and our decision making. So we're looking at the same data sources they are and looking at our local picture.
From WBIR, they've asked, some of our viewers say they feel like the city and county mayors are giving mixed messages. Kincannon says stay at home or you might get cited. Jacob says go out and enjoy the greenways / help local businesses. Can they clarify?
Well, I think that there's a lot of, they're on the same page as far as the stay at home or the safer at home order that we have in effect. I think this is really about making sure that people are doing the right things and continue to stay away from each other and social distance so that they continue to keep 6 feet apart, so we're not mingling and we're not shedding or spreading germs that we don't need to spread to each other in this time. Specific questions would need to go to the mayor's offices.
WBR has another question. They say, anything new to tell us about testing of the staff and residents at the unnamed assisted living facility? Have the results of testing been returned?
We have received all of the results of testing. We did identify one additional staff member and all precautions have been taken. That person has not been in the facility, and everybody else at this point has come back negative. You will also see, well, you won't see it, but we have one different number, and that one of our 3 residents actually has been reclassified as inconclusive, and they're getting another test run. So we're waiting on confirmation from that one case that we had previously reported as positive. But at this time, everybody else, staff and residents in that building are negative, and we're very happy to report that.
Another question from WBIR, with confirmation that the Army is looking at UT sports facilities, what other facilities have been looked at in Knox? Dorms, Old Convention Center has been a Red Cross shelter before during Katrina. Schools, the old Knoxville Center Mall.
I think that it's important to know that these discussions and the plans and facilities are being looked at. I'm not directly involved with those. And so I want to say that we don't have details to release at this time on those, but we are looking at various facilities in the area that could serve for this purpose if needed, but it's very early and too early to release details at this point.
The Sentinel has asked, there was reporting yesterday that the Army Corps of Engineers is considering sites like Thompson Bowling Arena at the University of Tennessee for possible emergency use. Has the county considered facilities for similar purposes? If so, what are those facilities?
I think it's important to know that what the Army Corps of Engineers and the county's doing and all of us are it's the same planning efforts. And so those aren't separate paths that are happening. We're talking to each other and working together. So my previous answer still applies to this one.
All right, this next one is a longer one from WBIR. It says the estimates for Tennessee show the state is expected to reach the peak for deaths per day by mid to late April. By April 20th, IHME estimates Tennessee could see a peak between 124 to 199 deaths daily before those numbers begin to recede. If no new infections are reported, the data estimates new deaths will taper off by mid-May, projecting there could be between 2,500 to 4,100 total deaths from the virus. Furthermore, do you feel like when new deaths and new cases begin to taper off, that we'll begin to be able to lift social distancing guidelines? And then there's a couple more. I'll let you answer that one and then we'll go to follow-ups.
That was a big question. So I think the important thing to remember here is, again, going back to all of the things that we can do as community members, the way that we can empower ourselves to affect those numbers. And that's really where these stay-at-home guidance, if you don't have to be out and about, don't be out and about. When you do have to go to the grocery store or to pick up food, that you're staying away from people, that you're washing your hands frequently, that you're not touching your face. All of those things affect that denominator, the bottom number, the total people that get sick, and affect our numbers. And so we really want to, and we don't have a crystal ball to know whose model is going to be correct or anything of that nature. So we really want to say that what we do know is that social distancing works. We have history and data that shows us that. And so we really encourage everybody to stay the course so that we are in a better situation as we get to the end of this month and moving forward.
Their follow-up to that question was, are we doing enough with social distancing? We're graded pretty badly. Can we enforce more, and will that help?
I think that, we talked about this yesterday, I think, and part of our gratitude is we're hearing isolated and smaller numbers of people that are not following the order, but we are seeing so many positive stories, and it's so evident that people are staying home. And we want to continue to encourage people to do that. Our staff will continue to educate people when there's questions or concerns or complaints, but we really want people to take ownership of what they can do to protect themselves, their family, and the community in this situation.
The Sentinel says, as a follow-up, they said, to be clear, all specific information on the number of ventilators, number of hospital beds, and the number of masks is being handled by the state, correct?
That is correct. It's a state system, and questions on those need to go to the state.
And so they follow up to say the county will not be addressing those questions, correct?
Correct. The county will not be providing specific numbers for individual facilities for those things.
And then they added in other municipalities like the city of Memphis has been releasing some of this information like beds and ventilators.
Okay, we are not at this time.
All right, from WBIR, they say, if this virus fight is a marathon and getting people back to work and businesses back open is the finish, what mile do you think we are on in Knox County? Mile 4, mile 7, mile 11? We need a mile.
That's a really good analogy. I think we're continuing to be on the early end. We are continuing to see cases rise, and I think everybody needs to know that. We will be on the downhill, hitting mile 13 and moving down when we start seeing our cases go down. And again, we don't have a crystal ball to say when that'll be, but we feel very strongly that the measures we're putting into place will help our situation for this.
Okay. If anyone has any additional questions, or there's a lot of text in there today, so if I accidentally missed one of these questions, go ahead and ask your question in the chat box right now.
I feel like we need music playing while we wait.
Elevator music. We have one question from WIR that asks, how are you all doing?
Wow, that's a great question. We're tired. We're working a lot. We're working 7 days a week. We're dealing with very difficult decisions that we're making and talking to people through very difficult circumstances every day. And that's challenging, but we're also very confident and comfortable in our response, and that we know that what we're doing and what we're recommending is the right thing, and that's what's helpful to us during this time. We also have a really great family environment where we're able to talk to each other and work through any issues or concerns we have. So we're doing well given the circumstances at this point.
Any other questions from anyone in the chat? Going once, going twice. All right, well, thank you, everybody. We appreciate you joining us for this virtual news briefing. I hope you have a great rest of your day.
I should stay there, still a lot less.